Hi, I'm Dr. Dan Watson from Urology Specialists of the Carolinas. I'm here today to talk about PSA testing. PSA stands for Prostate Specific Antigen, and it's a chemical that's made in your prostate. Most of it stays in the prostate, but some of it can leak out into your bloodstream, and so we can measure it in your blood with a simple blood test. PSA is not a perfect test, but it is a good test as a screening test for prostate cancer. But prostate cancer isn't the only thing that can make your PSA elevated. The most common cause of an elevated PSA is benign prostatic hyperplasia or prostate enlargement, which is very common in older men. Prostate infections or prostatitis can also make the PSA elevated. But the thing we worry about is prostate cancer. If your PSA test comes back slightly elevated, usually you have about a 30% chance that you have prostate cancer, but a 70% chance that you don't. Another thing to be aware of is that ejaculating can make your PSA rise slightly. So we usually recommend abstaining from sexual activity or ejaculation for 48 hours before you have your blood tested. If we determine that your PSA is elevated, we would usually recommend a prostate biopsy, which is a 10-minute procedure done in the office with local anesthesia. If you'd like to ask more questions about it, we can talk to you about it during your office visit, but it is a fairly simple procedure. Now, there has been some recent talk in the lay press about whether or not to have your PSA tested. There has been good data that shows that PSA testing does reduce the death rate from prostate cancer. So the American Urologic Association, as well as us, we do recommend that you have your PSA tested. For African American men, we recommend starting at age 40. For Caucasian men, starting at age 50, unless they have a family history of prostate cancer, and then we recommend starting at age 40 for them also. If you have any questions about PSA, please visit our website. We're here to help.